So thanks so much, João, for joining us.
Thank you very much for the very kind introduction. Basically, what I'm very humbled today is to share with you some of the experience that we had for more than 10 years with WHO working specifically on the NCD field. And before that, as someone who worked in a Ministry of Health for many, many years. Can you see my slide, if I may ask?
Oops. Oh, sorry. We can see your slide. It is in preview mode, not slideshow mode.
Is now in slideshow or not?
We see your notes.
You see my notes. It's not good. Wait a moment. I think I can swap this. Is it okay now?
That's perfect. Yes.
All right. So,
Thank you.
as I was saying, thank you very much for the invitation. It's a pleasure to be here. Now, my role is more related with the health systems, which of course are very important for NCDs as well, but in a different division. Before I was for a long time working more on nutrition as program manager, and then as the head of the NCD office in the WHO Regional Office for Europe. And now we've embraced with the government of Greece, with the support of Greece, in this very exciting endeavor of developing a quality of care and patient safety office, which is fully dedicated to this topic, and it's innovative in the way that it's the only office of its kind in the European region, and it's kind of an interesting experiment also, I mean, in global terms. And of course, a lot of what we do is related and makes a lot of sense to non-communicable diseases, and obviously non-communicable diseases, these are the areas where we have to do more in terms of quality of care. And I will explain during my short presentation, which will be maximum 20 minutes. You'll see I have many slides, but they are more just an illustration to help me make the point. So, I mean, decisively in the European region, we have a strong focus on public health, and we have a vision for public health, which is inscribed, which is part of the European Program of Work, which was proposed by our regional director some years ago, and it's really the public health policy for the European region. And here, definitely the issues of ensuring that we move towards universal health coverage with a very strong focus on quality, but also the aspects of health promotion and well-being are very important, and you all know how significant they are in relation with non-communicable diseases. There's also, as part of this, let's say, pan-European public health policy, there's main priorities, but there's also a couple of flagship initiatives which are also very strongly related with non-communicable diseases, and then you can read in the slide. So really a very strong focus, continues to be very strong. The European region suffers a lot from non-communicable diseases, and when I talk about the European region, I'm talking about 53 countries, so not just the EU, but far beyond that. So we have really, in terms of geography, we are the biggest region of WHO globally. And this is very important, of course, to make sure that we implement the Sustainable Development Goals. I know this is very theoretical, but the UN framework is really very important in terms of, let's say, working like a lighthouse in terms of what countries need to be doing. And here, if you look at the SDGs decisively, and definitely there are many aspects where NCDs play a role and many aspects where we can work to improve NCDs. And in this slide, I have a few examples. NCD 3, of course, is related with health. And of course, there are even indicators and sub-indicators which talk about the aspects and the areas of NCDs. But there are others, and I put here SDG 2 and 12 just as, again, a very simple illustration. So we know exactly what we want in the European region, and we are inspired by a global agenda related with the SDGs. And people in the past, colleagues have made an effort to really link up all these SDGs with the non-communicable diseases, and particularly with the SDG 3, which is the one related with health. And you see here in this complex net how there is really a very strong connection, and it's how decisively NCD work can be in terms of achieving all of this. So it's again further expanding in terms of the critical aspect that tackling NCDs can represent in terms of achieving the sustainable development goals. This is a bit, I mean, the framework which is really important to take into account. In the European region particularly, we have a strong focus on really making sure that we leave no one behind and that we protect the most vulnerable, that everything we do is for everyone, but it's really paying a lot of attention to those who need more our support. And when you think about well-being and when you think about health in the European region, you would see that this is strongly affected by non-communicable diseases as one of the main factors, and that those who are in the most vulnerable groups, they definitely are the ones that suffer more from non-communicable diseases. And WHO Europe is really working on this very strongly, to the extent that towards the end of the year, we will be actually having a very important event related to this. So taking on NCDs in a general way, but at the same time making sure that we do more work that can really recalibrate and improve this balance for those who need more. Why do we have to do this? Because, I mean, it's not rocket science. It's nothing new, but everybody knows that globally, the burden of NCDs is very big. Of course, with the cardiovascular diseases at the top, cancer increasing and becoming more and more relevant. And when we come to the European region, this is even more prevalent. As you can see here in this slide, we see on one hand, the main causes of death and disability, and the related risk factors. And you would see that from the most significant 10, 9 of them are actually related with NCDs. So by far, non-communicable diseases are still the biggest challenge we have in the European region, and they are generated by lifestyle risk factors to a large extent. And of course, they also depend, and tackling them and preventing them also depend very much on the performance of our health system. This is why this all needs to work in tandem and work together. Again, a different way of presenting it, which brings together some of the main risk factors. As you know, alcohol, tobacco, physical inactivity, and unhealthy diets. These are the most significant risk factors in terms of premature mortality and also multimorbidity, and they have also very significant economic cost. So really development and really tackling health and well-being for the future, as it was in the past, needs a very strong focus and a very strong approach to non-communicable diseases, but not in a very, let's say, generic way. We have to be clear and be very precise that we are talking about tackling alcohol, tobacco, physical inactivity, and also unhealthy diets in a very clear way. Because again, in the European region, these are the main risk factors, of course, but things are kind of shifting a little bit and changing. We are in a situation where, for example, dietary risk factors are becoming more and more important in proportion. Not they are more important than tobacco or alcohol, but I mean this, as we make progress, particularly in the tobacco area, the unhealthy diet become, let's say, more. They have more weight in terms of what's in the plate. So really handling these risk factors is very, very important. Therefore, you need to focus on the prevention aspects, but also in terms of the secondary prevention and the tertiary prevention, using, let's say, old-fashioned terms, but that are here called really into action as well. So big challenges, which they are diverse across the European region. This is a map where you can see, of course, that we have higher prevalences in the eastern part of the region. The darker, the more prevalent. But we also can present it in a way looking at the progress, and the progress has been very significant in Western Europe. Because we made a lot of progress, probably we are moving slower now, and there's countries more in the center and the eastern part of Europe which are, let's say, doing faster progress in a way that paradoxically, we have countries we've done very well in the past, but in terms of WHO targets, they are moving on the slow side. What I want to say in this slide is that this is a big challenge for everybody, even those who have achieved a lot in terms of dealing, for example, with cardiovascular diseases and cancer. We all need to do more because it looks like that we are not really going to achieve the WHO targets for NCDs so easily. So more to be done. Different parts of the region have different challenges, and this is very important. Also, as the most important element for quality of care, let's say globally and also in the European region, is that if we improve the quality of the continuum service that we provide for NCDs, this is where we can really have the larger benefits. If you look at this slide, you see cardiovascular diseases at the top. This is actually the disease where poor quality more affects our outcomes. And we're talking about using prevention, using early diagnosis, and using all these things in a way which really improves quality and allows us to save more lives. So I want to say that both the prevention element but the health systems component are very, very important. Many countries, people who need very simple medication to target and to tackle non-communicable diseases, they don't have access to it. Simple things we have more easily in Western European countries, they are not so accessible in other parts of the WHO region. And vulnerable groups, even in the richest countries, don't have access to that. So the health systems component needs really to be really strengthening in terms of how we use primary health care and how we use, of course, this health systems improvement and putting people at the center, taking the patient experiences more into account is very, very important. So in a nutshell, I would like really to push for this comprehensive approach. And then also being very pragmatic. We know that there are really low-hanging fruits. One of them is salt. So simple. A lot of people that have high blood pressure, they don't know. Many you kind of know they are not being treated. You know, those who are being treated sometimes not even controlled, and only 1 out of 7 globally, and even worse in some countries in our region, are actually being controlled. We could save so many lives in a very short period of time if we do more in terms of looking at the low-hanging fruits in terms of non-communicable diseases, improving quality on dealing with blood pressure, not just high blood pressure, but dealing with blood pressure in a continuum. That's really very important. Low-hanging fruit, low cost, saving thousands and thousands of lives. So, but these challenges also permanently exist and others are evolving. We still have a huge challenge with the alcohol consumption in the European region. Obesity is increasing and progressing in the negative direction. So we have the old classic challenges that we haven't been yet able to fully deal with. Although there are areas of good progress, we still have very significant challenges here, both from, let's say, the prevention and the treatment side, if you will. Childhood obesity, highly prevalent in many European countries. It's almost 1 out of 4, 1 out of 3 children, school-age children that have overweight or are already obese. And this didn't improve, actually things didn't improve with COVID, they got worse. This is a huge study in this slide made in the US that shows that actually the trends in BMI during COVID pandemic among children and adolescents actually have gone up, and there is probably significant increase. So like Suzanne was very well pointing out, this has not gone away in any means. So we really need to do more. NCDs have been challenged by COVID, and they were also a big challenge for health systems and for people working in NCDs to deal with it. We are very proud in the NCD office. The regional director was actually one of the first persons through his editorial in Lancet very early in the process to really highlight the linkages and the need to address non-communicable diseases. We also documented the huge disruption of NCD services, both prevention and treatment during COVID times, and the fact that some of these gaps still persist and have not been totally recovered or addressed. I already mentioned the links with obesity, which were, and also diabetes, and this challenge, this interconnection between, infectious diseases, respiratory infectious diseases that sometimes people would tend to resist, that they have something to do with NCDs. They're actually highly affected by body weight and by adipose tissue, but also levels of physical activity play a very significant role, and so on and so forth. So it is time, more than ever, to do more on NCD. And we kind of know what needs to be done. WHO has worked on best buy, WHO has worked on recommendations in different areas, in the area of physical activity, in the area of alcohol, tobacco, and all of that, nutrition. But, we really need to do things in a more decisive way. I would say that it's very important to take, a life course approach. And sometimes what we forget is that there are prevention actions before conception, during the periconceptual period, and then during pregnancy, and so on and so forth. So NCD prevention starts very early, starts with young people, and starts then with their offsprings. And we haven't been doing enough. One of the areas where we can influence more is on nutrition and physical activity. Of course, we know that smoking and drinking during these periods, of course, we know what the recommendation is, but more could be done in terms of a life course approach to non-communicable diseases, starting with things like breastfeeding and so on and so forth. I mean, there's a lot of huge amount of evidence that shows that the period of breastfeeding is so important, helps preventing childhood obesity, that the introduction of complementary foods is very important. And then that, nutrition during the course of infancy and adolescent period is also very important. We know that there are really critical elements when it comes to, for example, the prevalence of soft drink consumption, sugary drinks. This is a slide that shows the amount of sugar in the same soft drink in different countries in Europe, and you see the difference. So a lot that can be done in terms of a regulatory and legislative approach eventually, if governments are to take action, and we hope so. We advocate for a very strong link actually with the issues of climate change and sustainability from different aspects, being it tobacco, alcohol, and particularly food and nutrition that have a strong role to play. I've talked about salt. We have solutions for salt reduction and tackling hypertension as well, and of course the issue of climate change. We don't forget alcohol. I talked about it, responsible for a very large burden. The European region is the one with the highest consumption, very significant, much higher than any other region globally, and really more needs to be done in terms of reducing alcohol. More is being discussed about alcohol and its relation with, for example, with cancer. There's very strong evidence supporting that. Also cancer and nutrition, body weight and body fatness with cancer. These are relatively new elements where the evidence is building up in terms of addressing and tackling the NCDs, and this is really very important. As I come close to the end of my presentation, just to say that, this is all very nice, and the advances of science show us really the importance of being innovative in NCDs. But there's the old ones and the things that we still need to do, particularly in the area of tobacco. We still have really tobacco as the biggest risk factor, in spite of WHO having a very strong framework and policies that really advocate for tobacco policies in countries. There's still many challenges in the European region, we still have very high levels of consumption, particularly in certain countries, and things in some cases are not looking that nice. We believe that particularly the tobacco industry needs to be tackled very strongly as the vector of the tobacco epidemic, and one should not forget that we need to tackle NCDs. Tobacco needs to be probably number one priority. Last but not the least, of course, physical inactivity is very significant, particularly in young people in Europe, and we really need to implement actions across the life course, make sure that we ensure that the vulnerables have access to opportunities to physical activity, and really build the case for physical activity related with environment. So a lot more to be done, which has developed recommendations in this case. So finally, to tackle NCDs altogether, we need to have an approach which really is comprehensive, and we need to use ammunition which needs to be specific, but at the same time comprehensive enough to tackle the NCDs in general. One of the arguments I would like to make is that using regulatory approaches, notably the use of taxes, is very important. And we are not the only ones to say that. A lot of people have said that, starting with Adam Smith, if you want, the father of economy, and more recently with others. So using, let's say, big ammunition to tackle NCDs, we believe it's actually very important, notably, and we have great examples from the use of taxation in tobacco, but also in terms of ensuring more regulatory approach in terms of tackling healthy diets, physical activity, and also the tobacco problem. Another element is really leaving no one behind. We have to make sure that we address the challenge that the poor get the poor quality in terms of health systems, and NCD is no exception, and we need to address that issue decisively, ensuring access and improving quality. How do you do that? We believe that PHC, primary healthcare, is really the entry point. WHO is working on this field for some time. We have developed recently a primary healthcare manual for children and adolescents that I would like to promote and try to sell here to the participants, which is really just to illustrate the need to really ensure that health systems take an approach to NCDs, but also a life course approach. In this type of tools, you can find many opportunities to really ensure that we develop more, particularly preventive work of later NCDs with children and adolescents as well. There's also an issue here, as I finish really on of science and trust. NCDs, not only with COVID, but NCDs is an area which is an area that suffered a lot with misinformation, and we really need to pay attention and also to really ensure that we use the science in the right way, we promote the right science, and that we really address the challenges also by misinformation. So in a nutshell, I think that next is really ensuring that we are able to respond to this crisis, these new challenges, in a flexible and moldable way. And I would argue that sometimes the way we address NCDs has been a bit rigid, and we have to be flexible. We need to keep focus on strategic elements with the functions and policies that are needed, but we also need to be able to be flexible, reorganize, take the most vulnerable to the top of our priorities and keep it there, and really ensure that health systems have the quality they need to address NCDs. So I think I would stop here with a picture from Greece and our team here at the Quality of Care Office. And maybe I apologize for maybe taking a little bit too long, and hand the floor back to Suzanne. Thank you.